afternoon, and good evening, good morning, everyone. This is Angelo, the editor at Pan-Asia tech platform TechNode Global, which features premium tech news and industry insights. And we also support founders, investors, and entrepreneurs, in providing a platform for sharing thought leadership and industry insights on entrepreneurship and innovation. So as mentioned earlier, we have Jonathan from Halodoc, we have Dustin from uHoo, and we have Hazwan from DoctorOnCall. Quality of life is definitely a subjective topic, right? So in our panel here, we have health tech startups and we have a climate tech startup to discuss, how COVID and how the next normal is affecting quality of life and how technology, is expected to make an impact, to make a change. So let's make some introductions first regarding ourselves and our companies. Jonathan, we go with you first.
Hey, thank you very much, Angelo. Hi, ladies and gentlemen. My name is Jonathan. I'm the CEO and co-founder of Halodoc. We are a health tech company. We focus on simplifying access to healthcare by the means of telemedicine and also different kind of healthcare service. The simplest form of us is you can talk to a doctor within 15 seconds and you can get your medicine in your hand within 30 minutes. Yeah, that's just a bit of us. I'll talk a bit more later.
Okay, on to you, Hazwan.
Hi, ladies and gentlemen. My name is Hazwan Najib. I'm the co-founder of DoctorOnCall. We're based in Malaysia. We are Malaysia's first and largest digital health platform, established about 4 years ago in 2017. We started off as a telehealth platform, but now we have moved into becoming a digital health platform where payers, patients, and providers can get together and get access to healthcare in a very seamless manner.
Got it. Thank you, Hazwan. On to you, Dustin.
All right. Thanks, Angelo. Hi, everybody. My name is Dustin, and I'm the co-founder of uHoo. And at uHoo, what we do is we help you understand the quality of air that you breathe so that you can create healthier and safer spaces, whether it be in your home or in the workplace. And in response to COVID-19, we also launched the world's first uHoo virus index, wherein we can give you a real-time assessment on the risk of the coronavirus surviving and becoming transmittable in any indoor space.
Okay, thank you for that, Dustin. Now, COVID as a catalyst. So we've seen how, air quality is a very important part of our lives now. We see everyone, wearing masks, staying at home, staying indoors. So maybe over to you, Dustin, in terms of COVID being a catalyst for change in terms of how we live and how our lifestyles are. Can you say anything about the trends and how technology from your end is making it sustainable, making living safer and better?
Yes, in terms of how we view it, air quality has always been taken for granted by people, whether you're reading it, whether it's in the home or in the workplace. But since COVID-19 happened, it put air quality at the top of mind of most people. So it really affected how people view things. So the mask is one way for you to protect yourself, but proper management of your home and in your workplace would also help in terms of minimizing the coronavirus risk. And it's not only the coronavirus, we're talking about any type of virus as well, because it's how you create better ventilation, how you ensure that the temperature and humidity are managed properly, how you reduce dust particles, how you reduce gases in the air. So all of these affect both the health in terms of your immunity and also how viruses survive and how they become transmittable in the air.
Yeah, thank you for that, Dustin. Now, in terms of health, I'll pass this question to Jonathan. What are the key challenges that the population is facing in terms of healthcare given the pandemic? I think this, we've seen how health tech has evolved pre-pandemic to today. What, in your mind, are the challenges, and how is technology addressing these with innovative solutions?
Yeah, so I think you use the word COVID as catalyst. I think it's a very important word to use. So maybe to create a bit of a context for people on the world who does not know about the healthcare challenge in Indonesia, even before COVID comes, we only have 3 doctors out of 10,000 population. compared to Singapore. I think Singapore have like 29 doctors out of 10,000 population, right? That's number one. So number two, we have 74,000 villages and 17,000 islands. So you can see that demographically, I think as a country, Indonesia has its challenge. Now, you can imagine with that kind of country landscape, when COVID comes, a lot of when people are locked down and whatnot, this become a reality that is being faced by the whole country for access in a very different manner. But because we have that landscape situation since even before COVID, it becomes a catalyst for people to really use a telemedicine service. So Halodoc have worked with 20,000 doctors before we have COVID. So when COVID comes, it's just become so normal for everyone. Okay, now I need to talk to a doctor, even though there is COVID, and I need the medicine sent to me. And the age group of user of Halodoc become very different. From earlier was only like targeting the 30 years old people. The funniest part was my 70 years old uncle who know me for the last 5 years that I've been doing Halodoc. He has no idea what I've been doing until COVID. So COVID comes and say, John, he called me, Jonathan, I've been using orthopedics and skin specialists 2 times this week, and I got the medicine sent to me within 30 minutes. I'll be using this again next week. So it becomes a new normal. And because of this situation, we also grow, expanding our service into different kinds of modes of healthcare access, among others, from testing like PCR tests over drive-thru. We are now the largest for that in the whole country. We are also providing now vaccination. So we are actually working very close with the government to simplify healthcare access for the country together with the government. So it's becoming a collaboration together because of the country challenge.
Okay, got it. Thank you, Jonathan. We'll get back to you later regarding the thing you mentioned about drive-thru testing and drive-thru the PCR certification. And on to you, Hazwan. COVID has changed the landscape in terms of how we work and employment, right? I mean, many businesses have closed down, have reduced operations, and this has affected employees and business people in many parts of the region now, which is making an impact on the quality of living and our safety. So how is your company or how is the industry helping address these challenges in terms of the workforce, in terms of healthcare coverage?
Thanks, Angelo. I think just a little bit of context. In Malaysia, the market is half the population would go to the public healthcare system and the other half would go to private. And in many cases, those that can afford private, because they are supported by employers or insurers, then they can go to private. So when COVID happened, when there's a lot of businesses slowing down, right, there has been a lot of layoff and whatnot. So automatically those coverage suddenly went away, right? So people now have to go to the public healthcare system at the time when the government is fighting to keep the hospital less crowded. They have like more influx of people coming to the public healthcare facilities, which is not good in the height of COVID, right? So the way we see this is, I think for DoctorOnCall, we are trying to solve the healthcare problem, the short-term problem, which is simplifying the access to doctors, sending medication to home and whatnot. But we're also looking at the long-term of a more sustainable healthcare to work with the payers as well. And the other thing I want to add is when COVID happened, one of the biggest challenges is the misinformation, or health misinformation. So we work closely with the government to address public concerns, right? So that they don't just rush to the government clinics or hospitals trying to get COVID tests or trying to ask questions or concerns and whatnot, because that is just going to make the whole system crumble, right? So we are providing a funnel for people to use so they can come read the information, do their self-assessment, talk to doctors first before doctors said, oh, I think you need further testing, go to the hospital. And that's not just for COVID, but also for other illnesses as well.
Got it, Hazwan. Thank you for that. Is there anything you'd like to add, Jonathan, in terms of the healthcare industry?
I think Hazwan has covered pretty much. I think I would say that every country, especially in Southeast Asia, would have its own local challenges with regards to access, in which technology in health can help to ease that way.
Got it. Thank you, Jonathan. So, Dustin, from your end, being in the business of climate technology, in the business of quality air, is there any particular trend or data point that is popping out, from the region or from specific countries in Southeast Asia or beyond that can be of interest in terms of how we view quality living in terms of the air that we breathe?
I guess one aspect we can look at would be how sustainability certifications are starting to gain more traction during the COVID pandemic. If we look at, let's say, the WELL standard, which comes from Delos from New York, it has started propagating more across Asia and even Southeast Asia, that they've already established an office in Singapore as well. So we'll be seeing more buildings become more sustainable, not just green, because green doesn't always mean that it's fully sustainable. Green is energy efficient. But when we look at sustainability, you have to consider health and well-being as well. So moving into that, we're also looking to transition from green buildings into healthy buildings. So when we talk about healthy buildings, it's not about sacrificing the health of people inside the building to attain more energy efficiencies or lowering the cost of energy. It's all about finding that balance wherein we're able to make a healthy environment inside the building without overconsumption of energy. Because when we look at the trends, we can also see that if your building is considered a healthy building, you don't necessarily have to spend more on energy. It's actually more energy efficient as well, because it goes back to design. So it has to be designed properly and not just operated properly. So we have to look at the full spectrum. So that's something that we see in terms of trends where people are jumping into right now, that buildings and homes and basically the built environment needs to be more sustainable. Because in effect, that also contributes to outdoor air quality. Yeah, so that's a whole other story that we can talk about.
Yeah, it involves engineering as well, right? And even urban planning, I guess.
Yep, exactly.
Thank you for that question. Now we talked about the challenges in terms of living and the quality of life that we have. So Jonathan, we chatted earlier about travel, right? So given the pandemic, travel restrictions are in place, and it's changed the way that we travel. So before we used to be freely able to travel across the region and other countries as well. Now you mentioned drive-thru testing, drive-thru certification. So do you think of this as a new normal? When we want to travel, want to go somewhere, you have to do this first. And how else does technology accelerate this particular trend?
Well, for me to use a crystal ball to talk about the whole world, I think it would be overstating. I can talk about the fact in Indonesia. So the fact in Indonesia is if you are about to travel, you need to show your certificate that you have done PCR tests or antigen tests to prove that you are not infected by COVID. And recently, there's a big talk about if you have done a vaccination, there's also a travel documents. Now, Halodoc, in the past 1 year, we have set up over 19 different locations for drive-thru, in which we use it for different purposes. We are also working not just drive-thru, but we also work with over 1,500 hospitals in the country. So patients can just comfortably use the apps of Halodoc to basically do the tests and do the vaccination in accordance to where they want. If they choose the drive-thru, they can go through our drive-thru, or they can choose the hospital of our partner. And the results of that test and the vaccination is all sent to their Halodoc apps, in which the government is accepting as a legitimate travel documents locally, at least. So to answer your question, will this be a new normal usage for the world? That part I'm not so sure, maybe, but I'm sure there is a lot of G2G discussion with regards to legitimacy and whatnot. But I think within the country, within inside Indonesia itself, I think it has already been implemented. And so far, I think we are working very closely with the government to support these initiatives.
Okay, thank you, Jonathan. Jonathan mentioned something about government initiatives. Now, let me ask you, Hazwan. Health is a very sensitive matter, which requires, a degree of privacy and security, right? We also have here a question from the audience. How are we addressing cybersecurity concerns regarding information with increasing cloud adoption in healthcare? I guess to add to that question, how are companies like DoctorOnCall, like Halodoc, addressing the regulatory concerns? Has COVID accelerated the way that governments, adopt these measures or improved security and privacy measures? And do you feel yourself having more influence in society or with the regulators in government? Not influence, but maybe, you have the means to do the change, right? So those two questions: how are we improving security, and how are we, being a mover for change in this regard?
Okay, thanks, Angelo. I think two parts of the question. One is cybersecurity, and the other one is the regulatory. The cybersecurity perspective, yes, there is, whenever the data is on the cloud, there is a risk that it get leaked, and that is the one thing that is a nightmare for many of us, that we don't want it to get to that point. So we do have to get to the international standard, HIPAA compliance, and a few other standards that is to protect the data of the customers, right? And it is not a one-time exercise. It is an ongoing exercise that we keep going, and using platform like some of the international provider for cloud solution and all that is known to have very good cybersecurity is also very important for us. Having said that, right, so that is also the same question that was posed by the industry, is that, oh, how do you make sure that the data is not leaked, right? But if you look at healthcare industry is pretty much 15, 20 years behind in terms of technology usage or disruption. A lot of your patient record are kept in a paper and filed in the cabinet in the doctor's clinic and whatnot, right? So if you think about it, how is that safer, right? When someone can just go and dig out your files from any clinic and access your information, right? So we are making it better, more transferable in terms of data. So the patient own the record, but at the same time, let's not forget that whatever that we are doing today is making the whole patient data security a lot better than it used to be, right? Secondly, on the regulatory component, it's a lot easier to work with the regulators when there is a clear need of digital health in the public healthcare system, right? As I said, the government is working hard to make sure that everyone who comes to the clinics and hospital have a pre-booking, pre-appointment, and those who doesn't need to come to the hospital may stay at home and do the teleconsult, because even though the regulators technically are not ready, because there's no act or regulation that has come up to support telemedicine, right? So now the data is there, the usage is very clear, right? So it's a more how the regulators are shaping the regulation so that it can govern the space better, right? Which is actually a great thing for any technology company to work with the regulators in shaping the regulations.
Thank you, Hazwan. Before you move on to Dustin, is there anything you'd like to add to that, Jonathan, in terms of the privacy, security, and regulatory aspect of healthcare?
Well, I think Hazwan has covered very well. I don't want to say the repetitively. I think maybe just to give a bit nuances of different countries for the audience here would be like Indonesia as a country. I think the government or the regulator have always been very forward-looking with regards to digital healthcare. So way before this pandemic situation, I think the government has always been very supportive. They've been like, okay, do what you think is needful. Talk to us, and we create regulation around it. So when COVID comes, it's not like, hey, please come now. We are actually already in the office of the Ministry of Health 2 days before the announcement that the country officially say, hey, COVID is here. So we already discussed what can we do together. on solving the problem of the country, from the use of telemedicine, from the use of drive-through tests and whatnot. So I think it's very important to have a government that has this interest. Maybe it comes from the derivatives of the president. I think it is very well known that the president of Indonesia, Mr. Jokowi, is very into technology, very much supportive of the digital economy, like the Gojeks of the world, the Tokopedias and others. So they are his. So the whole minister is very much supportive, including the Ministry of Health, with the incoming of a health tech company like us. So I think I think I go. It's more about the nuances on each of this country with regards to this.
Thank you for the country perspective, Jonathan. Now we move on to Dustin. Hazwan earlier mentioned something about regulations, right? So you earlier mentioned also the wealth standards. So how is COVID accelerating, or how is uHoo being involved in working toward better regulatory practices in terms of, you mentioned building codes, you mentioned engineering standards, right? In your target markets and also in markets here in Southeast Asia?
I think it's more of, because the way we want to transition in this market is not to just jump into regulation immediately. We'd want to create standards first. So when we look at, let's say, the different standards in different countries, they evolve at their own pace. So if we look at, let's say, Singapore and the Green Mark standard, it's continuously evolving and it's starting to look at indoor environmental quality as well. When we look at Hong Kong, it's also evolving in the same manner. So as this evolves, eventually these standards would become a regulation. If we look at, let's say, Europe right now, because of the pandemic, they started giving out grants for schools to deploy certain air quality monitors. And with that, they're looking at how do we make this into law in certain countries like the Netherlands and Germany and the UK. So they're already looking into that, because when these technologies are deployed in these locations, all the data can be pushed back to the government and it becomes a necessity for compliance. Because once these facilities comply with these kinds of regulations, they can ensure a healthier environment. So eventually, in the long run, it's all about ensuring healthier spaces. That's why these regulations would eventually come in. It's just a matter of time.
Okay, thank you for that, Dustin. So I guess perhaps to wrap up a bit, let's see if you have questions. Okay, so the question we have to the panelists, what's next for health tech? I guess we expanded it a bit. So in the medium term, let's say in 5 years, in the longer term, let's say in 10 years, how do you see the quality of life? I mean, how do you see the pandemic? Hopefully post-pandemic, how would living change for us here in the region, and how would technology companies like yourself have an impact on the way people live, the way we think, the way we move, and how we move forward? So over to you first, Dustin.
I guess one thing that the region lacks today is data on buildings and also the home environment. If we compare, let's say, homes in Southeast Asia with homes that are built in the US or Europe, all the homes there have proper HVAC systems. So that means they get fresh air, they get proper ventilation. Whereas if we look at homes in Southeast Asia, if you switch on your aircon, you're breathing in your own breath, basically, because there's no ventilation. But if you don't switch it on, it gets too hot, that it becomes intolerable. But if you have an HVAC system inside your home, you can still have proper fresh air. So these are the things that we hope eventually in the future Southeast Asia would have as well when it comes to designing homes and buildings.
Thank you, Dustin. Yeah. How about you, Jonathan? In terms of the medium and longer term, what are the changes we can expect, and how will you as a technology company, have an influence or impact on this?
I think the one thing for a fact is patients all around the world become a lot more educated about healthcare. COVID pushed everyone to read WhatsApp, and rechecking about some of the information in their WhatsApp, right? Is this hoax or is this real? And this will not stop only on COVID. It will apply towards, cancer and other parts of needs, in which digital healthcare will be the first part of their entrance of the journey of healthcare. So in the past, I think before COVID, people will go to hospital straight. Today, I think a few years ago, maybe people start going with Google first. Now, with the existence of technology like Halodoc, DoctorOnCall, and other parts of the world, I'm sure, I think it's already coming that people are comparing notes before they even go to doctor. And because they don't want to, if they say, if I can solve the problem here, why should I go? And if I go, I really want to talk properly and with the proper notes. And I think this will stay for a long time. So I think what will change is for a country like Indonesia, where for the longest time, it has been a very supply-driven market or a provider-driven market. It's moving towards a lot into very patient-driven market. And I've heard this a lot from also my friends or colleagues in doctors that meet physical patients. Now, patients already come with hypothesis of solution. So they basically come to the doctor and say, is that correct that I should take this medicine and the treatment will be this and that? So the doctor have to improve themselves because this patient is now coming with equipped information. And I don't think this will be reversed. So going forward, I think this is something that will last forever.
Okay, thank you for that positive note, Jonathan. On to you, Hazwan, in terms of the medium term and in terms of your impact on this market, on your users.
Okay. So thanks, Angelo. I think in terms of the medium to long-term plan, I think what COVID has taught us that there's no healthcare system that can cope with the surge of pandemic or any like sudden increase in number of patients that is being handled by the system, right? And because of that, and one of the problems that we're trying to solve at DrOnCall when we first started is the healthcare inflation, the cost that is going up 20% year on year and all that, right? What we foresee is in the future, the healthcare is getting more, if we were going at this rate, the healthcare is getting less sustainable because it's getting more expensive for the insurers, the payers, as well as the patients themselves, right? So the cancer treatment today will be, by 2030, the cancer treatment will be 5 times more expensive, same as stroke or any other illness, right? So we are looking forward to rather, in the short term, providing the alternative channel or medium to get to the doctors, to get medications, to get services and all that. But in the longer term, we're looking for to play a key role in providing sustainable healthcare by probably looking more into preventive healthcare as well. So rather than, because we are so used to, when we get sick, we go and see the doctor. But now we want the doctors to preempt, right? Before you even get sick, I think this is what you need to do. And in order to do that, there's a lot of things that needs to change, right? So for instance, the doctors must be looking at compensated on the patient outcome, right? So the healthier the patients are, the more money you make probably, right? And that is not something that is common in the healthcare today, right? So we are trying to move with the industry to provide preventive healthcare with the help of a set of qualified doctors and services.
Got it. Thank you for that, Hazwan. We have a question for Dustin. What is the next step for uHoo in regards to enhancing our quality of lives or moving beyond air quality monitors?
So air quality monitors is one way for us to gather the data, but eventually the full service really is all about understanding the air. So when we look at, let's say, it's also about preventing, because once you have the data, you can understand the trends, you can prevent mold growth, you can prevent an asthma attack, you can prevent a rhinitis attack. So even today with the data that we provide, our customers utilize it to prevent or stop the next asthma attack, because they can get an early alert of what the triggers are if it's present in their environment, and they can take action immediately to reduce it. So that's one of the things that we're building right now. It's also these types of technologies that enhance the machine learning and also analyzing the data.
Thank you for that, Dustin. Now for closing notes, I guess we have a few seconds only. Any closing notes from you, Jonathan?
I think, first of all, I would like to thank you for the opportunity for me to share about what we do in Indonesia. I think the future of digital health is, in my opinion, is bright, and it's bright for all of us because every one of us will be part of a consumer of healthcare or wellness. Right now, the fact that that is a good catalyst for digital health. I'm very happy that our generation and our future generation, our sons and daughters, will have, hopefully, wherever they are, will have a better healthcare and well care because the existence of healthcare going forward. So hopefully, it's good for everyone here.
Thank you for that, Jonathan. I guess that's all the time we have for today, and I hope everyone echoes Jonathan's sentiments also on the future of wellness and healthcare. So thank you, and good afternoon, good evening, good morning to everyone in the audience.
Thank you.